Hello everyone, and welcome back to Health Diagnosis. Today, we're going to talk about a condition that many of us have either experienced ourselves or seen in others: tonsillitis. It's painful, it's uncomfortable, and if not treated properly, it can even lead to complications. But don't worry, by the end of this video, you'll know exactly what tonsillitis is, what causes it, the symptoms to look out for, how it's diagnosed, how it's treated, and most importantly, how to prevent it. So let's dive right in. Tonsillitis is the inflammation or swelling of the tonsils. You might remember being told as a kid that your tonsils are the two small lumps at the back of your throat. These tiny organs are actually part of your immune system. They help your body fight infections, especially in childhood. The tonsils trap bacteria and viruses that enter through your mouth or nose. But sometimes, instead of protecting you, they themselves get infected, and that's when we call it tonsillitis. Tonsillitis can be caused by viruses or bacteria. The most common cause is a viral infection, just like the viruses that cause the common cold or flu. However, bacterial tonsillitis is most often caused by Streptococcus pyogenes. The same bacteria responsible for strep throat can be more severe and may require antibiotics. Distinguishing between viral and bacterial tonsillitis is important because the treatment differs significantly. Now, what are the symptoms? If you've ever had tonsillitis, you probably remember the sore throat. It's one of the earliest and most noticeable symptoms. The throat feels raw and painful, especially when swallowing. You may also notice that your voice sounds muffled or scratchy. Other common symptoms include red, swollen tonsils, sometimes with white or yellow patches of fever, bad breath, and swollen lymph nodes in your neck. In children, you might also see irritability, drooling if swallowing is too painful, or even loss of appetite. Viral tonsillitis usually comes along with other cold symptoms like a runny nose, coughing, and sneezing, while bacterial tonsillitis often presents with high fever, sudden sore throat, and absence of a cough. That's a small but helpful clue for doctors to tell them apart. So how is tonsillitis diagnosed? Usually, a doctor will start with a physical examination. They'll look into your throat with a light to check for redness, swelling, and white spots on the tonsils. They may also feel the sides of your neck to see if the lymph nodes are enlarged. If bacterial infection is suspected, the doctor might perform a rapid strep test or take a throat culture. This helps identify whether the bacteria Streptococcus pyogenes is present. The test is quick and helps guide the right treatment plan. When it comes to treatment, the approach depends on the cause. If tonsillitis is viral, antibiotics won't help because they don't work on viruses. Instead, treatment focuses on relieving the symptoms. That means rest, hydration, and pain relievers like paracetamol or ibuprofen. Gargling with warm salt water, drinking warm tea with honey, or sucking on lozenges can also help soothe the throat. For bacterial tonsillitis, however, doctors usually prescribe a course of antibiotics, most commonly penicillin or amoxicillin. It's very important to complete the full course of antibiotics, even if you start feeling better after a few days. Stopping too early can lead to the infection returning or developing antibiotic resistance. In some people, tonsillitis keeps coming back again and again. If someone gets tonsillitis several times a year, or if it's causing serious problems like difficulty breathing or swallowing, doctors might recommend a tonsillectomy. That's the surgical removal of the tonsils. It sounds scary, but it's actually a very common and safe procedure. Most people recover in about 1 to 2 weeks, though the throat can be quite sore afterward. Once the tonsils are removed, the chances of recurrent throat infections drop significantly. Now let's talk a bit about the complications of untreated tonsillitis. Most cases clear up without any problems, but if a bacterial infection is left untreated, it can lead to more serious conditions. One such complication is a peritonsillar abscess, which is a collection of pus that forms near the tonsil. It can cause severe pain, difficulty swallowing, and even trouble opening the mouth. In rare cases, untreated strep infections can lead to rheumatic fever, which affects the heart and joints, or post-streptococcal glomerulonephritis, which affects the kidneys. That's why early diagnosis and proper treatment are so important. You might wonder, can tonsillitis spread? The answer is yes, it's contagious, especially if it's caused by a virus or bacteria. It spreads through respiratory droplets when an infected person coughs, sneezes, or shares utensils. So, if someone in your family has tonsillitis, it's a good idea to avoid sharing food, drinks, or toothbrushes. Wash your hands frequently, cover your mouth when coughing or sneezing, and disinfect commonly touched surfaces. Let's also talk about prevention. While you can't always avoid infections, you can reduce your risk by maintaining good hygiene. Wash your hands often, especially before eating and after coughing or sneezing. Avoid close contact with people who have sore throats or respiratory infections. Strengthening your immune system also helps us, so make sure to eat a balanced diet rich in fruits, vegetables, and vitamins. Stay hydrated, and get enough sleep. Avoid smoking or exposure to secondhand smoke, as it can irritate the throat and make you more prone to infections. There are also some home remedies that people find helpful for soothing the throat during tonsillitis. Warm saltwater gargles can reduce swelling and discomfort. Herbal teas like chamomile or ginger tea can provide relief. Staying hydrated is extremely important, even if swallowing is painful. Warm soups, smoothies, or even ice pops can help keep you nourished and comfortable. Remember, though, home remedies are supportive if they don't replace medical treatment when it's needed. Parents often ask how to manage tonsillitis in children. It's very common among kids because their immune systems are still developing, and their tonsils are more active. Encourage rest, fluids, and soft foods. If the child has high fever or difficulty swallowing, it's best to consult a doctor promptly. Don't give aspirin to children. It's associated with a rare but serious condition called Reye syndrome. In adults, tonsillitis is less common but can sometimes be more severe. If an adult experiences frequent or chronic tonsillitis, it could be a sign of deeper health issues, and a doctor might suggest further tests or removal of the tonsils. Recovery from tonsillectomy in adults can take a bit longer than in children, but the long-term benefits of fewer infections, better sleep, and improved quality of life make it worthwhile for many. Let's clear up a few myths while we're at it. Some people think removing the tonsils weakens the immune system. That's not true. The tonsils are just one small part of your immune defense, and as you grow older, their role becomes less critical. Your body has many other mechanisms to fight infection. Another myth is that you can catch tonsillitis from cold weather. While cold air can irritate your throat, the real cause is infection by germs, not the temperature itself. If you ever have persistent sore throats, high fevers, or difficulty swallowing, don't ignore it. Get a medical evaluation. Sometimes what seems like tonsillitis might actually be something else, such as strep throat, mononucleosis, or even, rarely, other conditions that need different treatments. The key takeaway here is simple: take care of your throat health. Don't push through severe pain or ignore recurring infections. Early attention, good hygiene, and proper care can make all the difference. Most people with tonsillitis recover fully within a week or two, but staying proactive about your health prevents it from becoming a recurring issue. Before we wrap up, here's a quick recap. Tonsillitis is an inflammation of the tonsils, caused mostly by viruses or bacteria. Symptoms include sore throat, fever, swollen tonsils, and difficulty swallowing. Diagnosis is made through a physical exam and sometimes a throat swab. Treatment depends on the cause. Viral cases are treated with rest and fluids, while bacterial ones require antibiotics. Prevent it by maintaining good hygiene and supporting your immune system. And if you or your child experience frequent infections, talk to your doctor about whether a tonsillectomy might help. That's all for today's discussion on tonsillitis. I hope this helped you understand the condition better and gave you some practical tips to handle it if it ever happens to you or someone you care about. If you found this video helpful, please give it a thumbs up, share it with others, and don't forget to subscribe to Health Diagnosis for more reliable health information and awareness topics. Stay healthy, stay informed, and I'll see you in the next video.